Hello everyone, today we are going to discuss about the sciatic nerve. Here you can see this is the anterior view of a pelvis and you have the femur here, you have the lumbar plexus here and sacral plexus here. Then you can see this is the greater sciatic foramen, this is the lesser sciatic foramen. This greater sciatic foramen is separated from the lesser sciatic foramen by sacrospinous ligament here. And you can see there is a thick nerve or big nerve emerging from the greater sciatic foramen here, then it goes like this way and it is the sciatic nerve. So sciatic nerve is a branch of sacral plexus which contain nerve roots L4, L5. Here you can see L4 and L5 come in here and join here, and also it contains S1, S2 and S3. What are the nerve roots of sciatic nerve? L4, L5, S1, S2 and S3. Then the sciatic nerve emerges from the pelvis through the lower part of the greater sciatic foramen, as you can see here, and it is the largest nerve in the body which consists tibial and common peroneal components. This has tibial component and common peroneal component and they are bound with a fascia. Here you can see a posterior view of gluteal region or posterior view of pelvis or gluteal region. Here, here this muscle is piriformis muscle. This is superior gemellus muscle. This is obturator internus muscle. Then you have the inferior gemellus muscle. Then quadratus femoris muscle. You have to remember those muscles. This is piriformis. This is superior gemellus. Then obturator internus. Then inferior gemellus. Then quadratus femoris muscles. So when we talk about the course of the sciatic nerve, you can see the nerve appears below the piriformis muscle. Here nerve appears below the piriformis muscle and it curves downwards and laterally, and then it lies behind the ischial spine. Then it also lies behind the superior gemellus muscle, obturator internus muscle, inferior gemellus muscle and quadratus femoris muscle. Those are the relations and you have to remember those relations as well. Then it goes further downwards, reaching the back of the adductor magnus muscle. You cannot see adductor magnus muscle here. Adductor magnus means a muscle in the medial compartment of the thigh. So this sciatic nerve lies behind the adductor magnus muscle. Or it is, and also it is related to posterior cutaneous nerve of the thigh posteriorly. You have this, there is posterior cutaneous nerve of the thigh. It lies behind the sciatic nerve. Also there is another posterior relation. You can see this cut surface, a muscle has been cut here. It is the gluteus maximus muscle. So this gluteus maximus muscle is also a posterior relation of sciatic nerve. Here I will show you the adductor magnus muscle. Here is the adductor magnus muscle, and in this picture here is the adductor magnus muscle. You can see this sciatic nerve lies posterior to the adductor magnus muscle in the thigh. After leaving the gluteal region, this sciatic nerve enters into the back of the thigh by passing deep to the long head of the biceps femoris muscle. Here you cannot see biceps femoris muscle because it has dissected here. You can see only short head of the biceps femoris. Biceps femoris muscle is origin from here to here, and this is the semitendinosus muscle. You have the semimembranosus muscle here. So the sciatic nerve enters into the back of the thigh by passing deep to the long head of the biceps femoris muscle. I told you earlier, sciatic nerve is formed by two components, tibial component and common peroneal component. So, sometimes the common peroneal nerve leaves the sciatic nerve high in the pelvis and appears in the gluteal region by passing above or through the piriformis muscle. Usually, there are no branches of the sciatic nerve in the gluteal region. In the gluteal region, sciatic nerve gives no branches. You can see in the posterior aspect of the thigh, the sciatic nerve has overlapped posteriorly by adjacent margins of biceps femoris and semimembranosus muscle. You have the semimembranosus muscle deeply here, and it has overlapped by the adjacent margins of biceps femoris and semimembranosus muscles. And I told you previously, it lies on the posterior aspect of adductor magnus muscle. In the lower third of the thigh, it ends by dividing into tibial and common peroneal parts. The tibial and common peroneal components are separated at the lower one third of the thigh. At this level, like so, you can see here is the common peroneal or common fibular nerve here. So this is the tibial nerve here, and the main two terminal branches are the tibial nerve and the common peroneal nerve. The sciatic nerve separates into tibial component and common fibular component usually at the lower one third of the thigh. Tibial nerve is a terminal branch of sciatic nerve and it enters into the popliteal fossa. Here you can see. And the common peroneal nerve here, the other terminal branch of the sciatic nerve, enters into popliteal fossa on the lateral side of the tibial nerve. You can see. The other muscular branches of the sciatic nerve are the branches to the long head of the biceps femoris, then to the semitendinosus muscle, then to the semimembranosus muscle, and the hamstring part of the adductor magnus muscle. There are muscular branches to long head of biceps femoris muscle, to the semitendinosus muscle, to semimembranosus muscle, and to the hamstring part of the adductor magnus muscle. These branches arise from the tibial component of the sciatic nerve and run medially to supply those muscles. So that's all about the sciatic nerve and its branches as well as its distribution, relations and the cause. Then I will discuss about the tibial nerve. Here you can see clearly common fibular nerve here, to lateral side of the tibial nerve in the popliteal fossa. You have the tibial nerve here. Then after descending through the popliteal fossa, it passes deep to the gastrocnemius and soleus muscles. Here, this is the cut edge of soleus muscle here. Gastrocnemius muscles are the most superficial muscle layer. Then the soleus muscle is the second muscle layer, and there is a deep muscle layer which contain flexor digitorum longus muscle, tibialis posterior muscle and flexor hallucis longus muscles. So this tibial nerve lies in between the soleus muscles and this deep muscle layer which contain flexor digitorum longus, tibialis posterior and flexor hallucis longus muscles. That means this neurovascular bundle lies in between second and third muscle layers of the posterior compartment of the leg. I discuss here the posterior compartment. The nerve of the posterior compartment of the leg is the tibial nerve. So, the tibial nerve passes deep to the gastrocnemius as well as soleus muscles. Then it lies on the posterior surface of the tibialis posterior and lower down the leg on the posterior surface of the tibia. As you can see here, the nerve accompanies posterior tibial artery. Here you have the posterior tibial artery, then tibial nerve accompanies posterior tibial artery. Here you can see this is the tibial nerve and this is the common fibula or common peroneal nerve. Here this is the soleus muscle, these two are the gastrocnemius muscles. You can see tibial nerve enter deep to the soleus muscle. That means I told you previously the nerve goes through the second and third layers of muscles in the leg, posterior compartment of the leg. Here also you can see clearly the posterior tibial artery and tibial nerve accompanying together in the posterior compartment of the leg, and the nerve first on its medial side. Here you can see the nerve first on the medial side. Here you cannot see that relationship here, but you have to remember the tibial nerve first lies in its medial side. Tibial nerve first lies at its medial side to the posterior tibial artery, then crosses posterior to it. Here, then it crosses posterior to it. And finally, it is on the lateral side of the posterior tibial artery. You have to remember that relationship. The nerve with the artery pass behind the medial malleolus. Here you have the medial malleolus. Here you have the lateral malleolus. Then this neurovascular bundle of the posterior compartment of the thigh, leg, neurovascular bundle of the posterior compartment of the leg goes behind the medial malleolus here in this area. This is the flexor retinaculum. Here you can see the neurovascular bundle and all the tendons of the posterior compartment of the leg goes behind the medial malleolus here in this area. So at this level, the nerve lies between the tendons of flexor digitorum longus and flexor hallucis longus. Here, this is the flexor digitorum longus tendon. Then this is the flexor hallucis longus tendon. This is the flexor digitorum longus tendon. This is the flexor hallucis longus tendon. You can see the neurovascular bundle, posterior tibial artery and tibial nerve lies in between the flexor digitorum longus muscle tendon and flexor hallucis longus muscle tendon. Then this area is covered by the flexor retinaculum, and then this nerve, tibial nerve, divides into two parts as medial and lateral plantar nerves. Here you can see lateral plantar nerve. It divides into lateral plantar nerve and medial plantar nerve. Terminal branches of tibial nerve are lateral plantar nerve and medial plantar nerve. Then the tibial nerve, after dividing the tibial nerve into medial and lateral plantar branches, it enters into the sole of the foot. Here, this is the medial plantar nerve, this is the lateral plantar nerve. The branches of the tibial nerve in the popliteal fossa, I forgot to tell you that. The branches are the muscular branches to soleus muscle, flexor digitorum longus muscle, flexor hallucis longus muscle, and tibialis posterior muscle. Then the cutaneous branches are medial calcaneal branch, which supplies the skin over the medial surface of the heel. Then there are articular branches to ankle joint as well. Then I will talk about the medial plantar nerve. Here, this is the medial plantar nerve and it is a terminal branch of tibial nerve, you know that. And it arises beneath the flexor retinaculum and runs forward deep to the abductor hallucis muscle. It runs deep to the abductor hallucis. Here, abductor hallucis muscle has been cut here. So, this medial plantar nerve is deep to the abductor hallucis muscle. It accompanies medial plantar artery. It comes to lie in the interval between abductor hallucis and flexor digitorum brevis. Here flexor digitorum brevis muscle also has been cut here. Here abductor hallucis muscle. So this medial plantar nerve lies in between flexor digitorum brevis and abductor hallucis muscles. Then muscular branches are to the abductor hallucis muscle, branch to abductor hallucis muscle, branch to flexor digitorum brevis muscle, and it gives a branch to first lumbrical muscle. Here. Then it gives cutaneous branches as plantar digital nerves. They run to the sides of the medial 3½ of toes. The course is similar to the median nerve in the palm. This course of the medial plantar nerve is similar to the median nerve in the palm. You can see these are the plantar digital nerves. Plantar digital nerves which supplies medial 3½ toes. The nerves extend onto the dorsum and supplies the nail beds and tips of the toes as well, like in median nerve. Then the lateral plantar nerve. This is the lateral plantar nerve, the other terminal branch of the tibial nerve. It arises also beneath the flexor retinaculum and runs forward deep to the abductor hallucis and flexor digitorum brevis as this medial plantar nerve. Then it accompanies lateral plantar artery here, and it reached the base of the fifth metatarsal bone. It reached the base of the fifth metatarsal bone and divides into superficial and deep branches. Here you can see after reaching the base of the fifth metatarsal bone, it has divided into, here this is the superficial branch, here this is the deep branch. This the course of lateral plantar nerve is very much similar to the ulnar nerve in the palm. So there are muscular branches from the main trunk to the quadratus plantae muscle, abductor digiti minimi muscle, and cutaneous branches to the skin of the lateral part of the sole. From the superficial terminal branch, this branch, you can see it is divided into two parts further. It supplies flexor digiti minimi and interosseous muscles of the fourth intermetatarsal space. Then plantar digital branches here, they pass to the sides of the lateral 1½ toes. They pass to the sides of the lateral 1½ toes, and nerves extend onto the dorsum and supply nail beds and tips of the toes. Then from the deep terminal branch, this branch curves medially with the lateral plantar artery. It curves here medially. Then supplies adductor hallucis, second, third and fourth lumbricals, all interossei muscles except those in fourth intermetatarsal space, because it is supplied by the superficial branch. So that's all about lateral and medial plantar nerves. I will discuss about the common peroneal nerve from my next video. Thank you for watching.